Hi, this is Randy Wykoff. I'm the Dean of the College of Public Health at East Tennessee State University, and it's a real pleasure to talk to you today. I'm going to give you a presentation today that's called Understanding and Improving Health, Lessons from Central Appalachia, and I'm going to focus on the vital role that food and food systems play in improving health. Over the last 20 years or so, we've come to learn a great deal more about what it takes to be healthy. And being healthy is both a bit more complicated, but also probably more achievable than we used to think. So what I'm going to do is I'm going to use Central Appalachia as a model to share with you these concepts that will be relevant wherever you live. As I say, I'm going to start with Central Appalachia because it's where I live. For those of you that don't know, it's the 238 Appalachian counties, all of Appalachian Tennessee, North Carolina, Virginia, and Kentucky, most of West Virginia, and parts of Ohio. So if you know that there's 400 or so counties in all of Appalachia, Central Appalachia is those 238 counties right in the middle. It makes up only about 3% of the U.S. population, but I think what we've learned here and what we're learning in other parts of the country are relevant to everyone. Our region is one of incredible natural beauty and a deep and rich culture and heritage. But it's also a region that suffers significant health challenges. And that's really what I want to talk about. And to do that, I want to pose and answer two questions. They're both what questions. What is the health status of Central Appalachia, and what can we do about it? To understand the health status of Central Appalachia or the state of Tennessee or any other region, really, you have to have something to compare it to. And so throughout my talk today, I'm going to compare Central Appalachia to the entire United States. And typically in public health, when we talk about the health status of an entire nation, the statistic that we start with is life expectancy. It is the most basic, fundamental measure of health. If you think about it, everything that goes into someone's life is reflected in life expectancy. How old is mom when she gets pregnant? Does mom use alcohol or nicotine or other addictive substances during pregnancy? Is that baby born in a safe environment? Does the child have adequate food and clean water? Can they get an education? Can they get a job? If they get ill or injured, can they get access to health care? All of that times 318 million is life expectancy in the United States. And if we went out and asked the man on the street to tell us something about life expectancy in the United States, he'd probably tell us two things. First, he'd tell us that life expectancy in the United States is probably the longest it's ever been. And here the man on the street would be correct. In 2014, life expectancy in the United States is almost 80 years. And that is the most it's ever been. In fact, in the course of the 20th century, life expectancy in our country went up by a remarkable 30 years. And this is entirely consistent with what the man on the street would think. The second thing the man on the street is likely to tell us is that life expectancy in the United States is probably the longest in the world. He knows that we're one of the wealthiest countries that has ever existed. We have a healthcare infrastructure unlike that anywhere else in the world. But here the man on the street would be wrong. Life expectancy in the United States is not the longest in the world. It's not even in the top 10, or the top 20, or the top 30. In 2014, the United States fell behind all of these countries with a life expectancy that is about 33rd in the world. In other words, 2.5 dozen countries that do better at this basic measure of health than does the United States. 2.5 dozen countries where a baby born today is projected to live a longer life than a baby born in the United States. Now, naturally, as with any country, we have wide disparities within the United States, from Minnesota with the lowest early death rate to Mississippi with the highest. If we look at the 6 states that make up Central Appalachia, you can see that all but one of them falls in the bottom half of the United States. And as worrisome as that is, it still doesn't tell us the whole story, because the population of the Appalachian counties of those states is actually a minority. In fact, less than a quarter of the population of the 6 states actually lives in one of the 238 Central Appalachian counties. So to understand the health status of these Central Appalachian counties, we've developed a way of graphically demonstrating these data. And basically what we've done is we've taken all the counties in America for which there are information, and we've created a graph. The lower side of this has a lower death rate, the healthiest counties in America, all the way to the highest counties on your right, which are the least healthy counties in America. And when you have a chart like this, you can see the median county, the middle county in America is right there. The value is 7,702. Now don't worry about what that number means, but really what it is it's years of potential life lost. It's how many years below the age of 75 you lose per 100,000 population. But the point of this is it gives us a way of comparing counties. So for example, if I can say that this is all the counties in America for which we have data, I can then talk to the folks in Hancock County, which is one of the Appalachian counties of Tennessee, and show them graphically where their county is. And all of a sudden you can see very clearly that Hancock County has a high premature death rate and clearly has some health challenges that we need to deal with. Now unfortunately I can't create a chart, I can't put 238 dots onto this graph, but what I can do is create a separate graph for the 238 counties of Central Appalachia. And that's what I've done here. Now on first glance this looks a lot like the U.S. chart, with the healthiest counties in Central Appalachia on the left with the lowest early death rate, and the least healthy counties in Central Appalachia on the right with the highest early death rate. But what you may notice is that this chart is quite a bit higher with a higher median value. So now what I'm going to do is I'm going to take the yellow chart of Central Appalachia and superimpose it onto the red chart for the entire United States. If Appalachia is healthier than the United States, it will have a lower death rate. The line will be below the U.S. If Central Appalachia is less healthy, it'll be higher. It'll come as no surprise to you to learn that it is in fact considerably less healthy. So there's Central Appalachia compared to the U.S. What you'll notice immediately is it's almost a third higher. Think about that. The 238 counties of Central Appalachia have an early death rate that's almost a third higher than the national rate. Another way of looking at this is that in fact 84%, 4 out of every 5 counties in Central Appalachia fall below the national median. Right? So put that into words, the median county in Central Appalachia has an early death rate that's over a quarter, almost a third higher than the national median. 84% of the counties fall below the national median, so here we are in a region that is considerably less healthy than the nation that ranks 33rd in the world. So a few minutes ago I started by posing 2 what questions. I suspect now you're not asking what, but why? Why should someone born in Central Appalachia be more likely to live a shorter life than someone born in most other states and in dozens of other countries? Why do we have health statistics in Central Appalachia that are so much less than we could achieve? And I say we could achieve them, we know we could because other states and other regions have. Why do we have health statistics in our region that are so much less than we could achieve? Well, as it turns out, this is not a rhetorical question. This is a question we can actually answer. We can answer the question as to why someone in Central Appalachia is more likely to die young than people in other parts of the country. And the way we're going to do that is we're going to look at the things that cause all Americans to die young and then ask the question, which of those are worse in Central Appalachia? Well, a few years ago there was an article published in the New England Journal of Medicine that identified the 5 factors that contribute to early death in the United States. Now these are not the 5 leading causes of death. The 5 leading causes of death are heart disease, cancer, chronic obstructive pulmonary disease or smoker's lung, stroke, or unintentional injury or accidents. 2/3 of Americans will die of heart disease, cancer, COPD, stroke, or accidents. But this is asking a different question. This is asking the question, what are the factors that cause us to get those conditions? And according to this article in the New England Journal of Medicine, there were 5 factors. Some of it's due to genetics. Some of us are just more fortunate and we happen to inherit a genetic predisposition towards good health or unfortunate health. Some of it's due to environmental exposure, a larger portion due to social circumstance. Now, people are often surprised to learn that the smaller of the 2 remaining health care. What this means is that if all Americans had access to the very best health care, which they do not, we would reduce our early death rate by 10%, which is really important. But the reason this surprises people is oftentimes when people are thinking about improving health, the only thing they think they can do is get more health care, another hospital, another doctor, another nurse, another clinic. And sometimes that's necessary. But often it isn't, because there are many other factors that impact health. And on this pie chart, you'll see that there's another factor that causes 40% of our early death in this country, and that's our behaviors. So these are the things that the New England Journal of Medicine article said that all Americans die from. So let's ask the question, which of these are worse in Central Appalachia? Is there something about our genetics? Well, obviously there's no reason to believe there is, and there's in fact at least one piece of evidence to suggest otherwise, and that comes from this woman, Bess Brown Cooper. She was born in Sullivan County in Appalachian, Tennessee in 1896. She graduated from what became East Tennessee State University in 1916, and she was our oldest living alumna. We know that because at the time of her death in December of 2012, she was the world's oldest living person. Not the oldest person from Appalachia, not the oldest graduate of ETSU, but of the 7 billion people in the world, she was the one known to be the oldest. And that doesn't prove or disprove anything, but probably suggests there's nothing innately wrong with our genetics that causes us to die young in Central Appalachia. I've asked whether it's health care. Maybe the problem in our region is we don't have enough health care. Well, there's no doubt that there are parts of the country, in fact all over the country, where there are what we call health professional shortage areas. And you can certainly see some in Central Appalachia. On this map, anything that's purple, gold, or green is considered a shortage area. And you'll see we have our share of them, but if you look closely, we're really not that different from other parts outside of Central Appalachia. So certainly there are absolutely parts of our region that need more and better health care, but that's not really the reason we're dying younger than people are in the rest of the country. Well, what about behaviors? Clearly that's the factor that causes the most early death, and let's ask the question, what do we know about those behaviors comparing Appalachia to the rest of the country? According to the Centers for Disease Control, these are the 9 factors that cause Americans to die young. It'll come as no surprise to you that number 1 is tobacco, followed by factors related to diet and activity, the so-called obesity epidemic. The percentages drop off here, but they're still important. Alcohol, 3.5%, infectious diseases, 3%, toxic agents, pollutants, and so on, 2%. Motor vehicles, self-explanatory. Firearms, self-explanatory. Sexual behaviors that leads to diseases like AIDS and other conditions, and illicit drug use. Now these are the things the CDC says that we're dying from. Let's ask the question, which of these are worse in Central Appalachia? All right, for the leading preventable cause of death, there's the nation, all the counties in America, from counties with almost 10% to counties with almost 30% smoking, and there's Central Appalachia, 30% higher on average, and 94% of our counties fall in the bottom half. So here we are for the leading preventable cause of death in our country, and 9 out of every 10 counties falls below the national average. So clearly this is one of the threats to our health in Central Appalachia. Another one to look at is obesity. Now people are surprised to learn that when you first look at it, it doesn't look like we're that much worse than the nation. We're about 6% worse, but in fact 2/3 of our counties fall in the bottom half. So clearly this is another behavior that's causing us in Central Appalachia to die younger than people in the rest of the country. The only other one of these I want to show you is illicit drug use, just because it's one of the factors that's changing very rapidly. If you look at this map, the brown and darker areas, brown and yellow, are estimated deaths from all-cause drug poisonings in America in 2002. You can see a small clustering there in Central Appalachia. By 2014, that has changed dramatically. And you can see what we call the prescription drug abuse epidemic is having a major impact here in our region. And I could talk about this list for a long time, but the basic message is yes, our behaviors are causing us to die younger than people in other parts of the country. And 10 or 15 or 20 years ago, this is where my talk would have ended. I would have said, look guys, we need to go out there and change behavior. We need to help kids not become smokers. We need to help current smokers quit. We need to encourage people to eat healthier diets, and so on. And that's still completely true. But it's not truly complete, because we're coming to understand a whole nother set of factors that impact health in our region and in our country. And these are the so-called social circumstances, or what some people call the social determinants of health. Now, the way to understand the social determinants of health is to think about it this way. We're all born with a genetic predisposition to good health or lesser health. That is impacted by our ability to access health care. It's certainly impacted by our behaviors. But increasingly we're coming to understand that it's also impacted by factors that go on outside of us, right? The so-called social conditions, the social determinants of health. Now, I'm not going to go through all of these. I'm just going to show you two of them. The first is income. Now, this is important to us in Appalachia because we know we have higher rates of poverty. This is children living in poverty comparing the U.S. to Central Appalachia. And you can see again, 27% higher, 83% of our counties fall below the national median. Now, this is important to us for two reasons. First, it's important because poverty is associated with poor health. I could show a lot of slides to show that. I'm just going to show you one. This is a slide that shows what's your chance of dying before the age of 65 based on your income, with wealthy Americans on the left side of the slide, poor Americans on the right. On this slide, we're going to call the risk of dying before the age of 65 for a wealthy American a risk of 1. A poor American has a risk of over 3. That means that a poor American is 3 times more likely to die before the age of 65 as a wealthy American. And what that means for regions like us with higher rates of poverty is we're going to have higher death rates until we can address these issues associated with poverty. So the first reason we need to percent of poverty in our region is it is directly impacts poor health. The second reason we need to care about poverty is because in our country the gap between rich and poor is getting wider. This is data from the Census Bureau. In 1973, they divided Americans into fifths, the poorest fifth to the wealthiest fifth. In 1973, the ratio of income for the poorest fifth to the positive fifth was about 10.5 to 1. Now, I want to make the point. Here we're not talking about the very extremely rich or the extremely poor. This is just dividing Americans into fifths. So 1 out of every 5 Americans is in the richest fifth, 1 out of every 5 is in the poorest fifth, and so on. 1973, the ratio was 10.6 to 1. A decade later, 11.4 to 1. A decade later, 13.8 to 1. A decade later, 14.7. And over 40 years, the actual buying power of America's poorest residents has gone down, while the buying power of the top fifth has gone up, and the ratios widened by 50%. Now, I don't put this up to make a political comment. I put it up to make a very important public health comment. What this slide means is that those parts of the country with higher rates of poverty, like Central Appalachia, are going to see widening economic gaps compared to those parts of the country with lower rates of poverty. And if you believe, as I do, that poverty is related to health, you begin to realize that this also means we'll see a widening health gap unless we can do something about the economic conditions in which people live. And all of a sudden, those of us who are passionate about improving health realize that we can't be successful if we don't start working with the business community, the economic development community, and so on. The only other one of these I want to show you is education, again, just because its impact on health is so dramatic. This is the only slide I'm going to show you where it's better to have a higher number. This is adults with some college. Unfortunately, Appalachia falls below the rest of the country, and again, about 83% of our counties fall below the national average. This should matter to us for 2 reasons. Again, first of all, because education is related to health. This is a slide that asks a simple question, which is by the time you're 25, on average, how many more years will you live based on your education? And you can see for both men and women, the amount of education directly translates into years of life expectancy. So for a woman, the life expectancy difference for a college graduate compared to a high school dropout is 5 years. For a man, it's almost 7 years. The second reason we should be concerned about the low rates of educational achievement in Central Appalachia is because the gap between educated and less educated parts of our country may also be widening. This is a chart that asks the question, if you're a high school sophomore, what's the chance of you having a college degree in 10 years? Not based on how smart you are, not based on whether you do your homework, not even based on what school you go to, but based on your parents' educational level. If your parents are professionals, 3/4 of those high school sophomores will have a college degree in 10 years. If the parents are high school dropouts, less than 6%. A 12-fold difference in the chance of a high school sophomore having a college degree in 10 years based on their parents' educational level. What this means is that those parts of the country with lower rates of educational achievement will see widening educational gaps over time. And if you believe, as I do, that education is related to health, you begin to realize that those of us who are committed to improving health can't be successful until we start working with those folks who are interested and committed to improving educational accomplishment. Now, I could talk about this pie chart for a long time, but I think the message is pretty clear. If we want to improve health in Central Appalachia, or in your region, or in the country as a whole, we have to make sure that we do certain things. We have to make sure that people have access to affordable, quality health care. We need to work, of course, to change people's behavior. But increasingly, we're coming to understand that we also have to work on jobs and education. And the key message here is that no one of those three can be successful without the other two. Every employer will tell you they need a healthy, educated, drug-free workforce. Every school superintendent will tell you they need parents and teachers and kids that are healthy enough to come to school, who are motivated to get an education, but who also live in a community with a sufficient tax base to pay for the kinds of programs necessary for school success. And every healthcare provider, of course, will tell you that they need people with the knowledge and the motivation and the resources to invest in their health. So these are the things we need to do to improve health in Central Appalachia and in the nation. Now, in the beginning, I told you I was going to reinforce the importance of food and food systems. You might look at this and say, wait a minute, you haven't talked about food. Well, let me say that every single statistic that I've given you could have been a food statistic. For example, if I wanted to talk about jobs, we know that are hungry are less prepared for school, both physically and mentally. We know that the parents of kids who are food insecure are more likely to have to miss work in order to take their kids to the doctor or to the hospital. So clearly, food insecurity has a major impact on jobs. In terms of behavior, we know that 3/4 of our healthcare spending in this country are due to chronic diseases, and many of our most important chronic diseases are related to food. Heart disease, certain types of cancer, stroke, diabetes, and so on. And in terms of healthcare, we know that kids who are food insecure are almost twice as likely to be in fair or poor health compared to kids who are not food insecure. And they're almost 1/3 more likely to be hospitalized. So clearly, the statistic that I've shown you to date could have been a statistic taken from the food system. But equally, and perhaps more importantly, the solutions to every problem that I've shown you could have been taken from the food side as well. In terms of jobs, we're increasingly coming to believe that in rural parts of America, especially in Central Appalachia, a reintroduction of a vibrant agricultural system may be one of the best, most promising economic development opportunities in our region. In terms of behavioral change, of course, we know that we've got to get people eating healthier diets, exercising more. In terms of healthcare, increasingly we're coming to understand that doctors and other providers need to be trained more in food and nutrition, but they also can start prescribing healthier diets. And we all understand and believe that the educational system is the single best place that we can educate kids about their health. So in fact, though I've only focused on those three things, we understand that food and food systems is the underpinning of everything. If I were to put this all into words, what do we have to do to improve health in Central Appalachia or in your state or in the nation? Well, we need to work together to assure access to health care, especially preventive services. We need to work together to encourage healthier behaviors. We need to work together to enhance economic opportunity and improve educational achievement. And we need to work together to assure an abundant supply of safe and healthy food. And what these all have in common, of course, are we need to work together. These are not problems that Nashville or Richmond or Washington, D.C. can solve alone. These are not problems for Republicans or Democrats or socialists or libertarians to solve alone. And these are not problems that people advocating for health or economic development or education or healthy food can solve alone. We will only be successful when we work together. Now, working together will impact people in every part of the nation, every state, but probably nowhere more so than our region of Central Appalachia. I want to thank you for your attention and for listening to what I've had to say. I hope some of it's been helpful to you. I'm sure many of you will have questions. Please don't hesitate to give me a call at that phone number or send me an email there. I look forward to hearing from you, and thank you very much for the work that you do.